Welcome to our comprehensive guide on mastering the NCLEX. Today we'll break down the most high-yield topics for registered nurses, focusing on prioritization delegation, staff management, and effective guessing strategies. Whether you're just starting your NCLEX prep or looking for that final boost, this video is packed with practical tips and insights. Let's dive in and set you up for NCLEX success, starting with the foundational concepts that every test taker should know. Prioritization is a cornerstone of NCLEX questions. You'll often be asked to decide which patient needs attention first. This requires a solid grasp of clinical urgency and the ability to quickly assess situations. Remember, the NCLEX wants to see if you can think like a nurse in real-world scenarios. We'll explore frameworks like ABC's airway, breathing, circulation, and Maslow's hierarchy of needs to guide your choices. Let's look at how these principles apply in practice. ABC's airway, breathing, circulation are your go-to framework for prioritization. If a patient has an airway issue, that always comes first, followed by breathing and then circulation. This approach helps you quickly eliminate options and focus on the most critical needs. For example, if one patient is having trouble breathing and another has a minor wound, always address the breathing issue first. This method is fundamental for safe and effective nursing care. Maslow's hierarchy of needs is another essential tool for prioritization. Start with physiological needs, like food, water, and shelter, before moving to safety, love, esteem, and self-actualization. On the NCLEX, this means addressing basic survival needs before considering emotional or social concerns. For instance, a patient in pain or unable to eat should be prioritized over someone who is anxious but otherwise stable. This hierarchy helps you make logical, patient-centered decisions. High-risk patients require immediate attention. These are individuals with unstable vital signs, new or sudden symptoms, or those who have just returned from surgery. On the NCLEX, always prioritize patients who are at risk for rapid deterioration. For example, a patient with chest pain or difficulty breathing should be seen before someone with a chronic, stable condition. Recognizing these scenarios quickly is key to answering prioritization questions correctly. Common NCLEX trap is confusing stable and unstable conditions. Stable patients have predictable outcomes and controlled symptoms, while unstable patients are at risk for complications. Always prioritize the unstable patient. For example, a diabetic with controlled blood sugar is stable, but one with new confusion and low glucose is unstable. This distinction helps you choose the right answer under pressure. Delegation is about assigning the right tasks to the right people. On the NCLEX, you'll need to know what you can delegate to unlicensed assistive personnel UAPs, licensed practical nurses LPNs, and what must be done by a registered nurse RN. The key is understanding scope of practice. For example, RNs handle assessments and teaching, LPNs can give medications, and UAPs assist with daily living activities. Let's break down these roles further. Registered nurses cannot delegate tasks that require clinical judgment, assessment, or teaching. This means RNs must handle initial assessments, care planning, and patient education. If a question asks who should assess a new patient or teach about medications, the answer is always the RN. Delegation questions test your understanding of these boundaries, so keep them clear in your mind during the exam. Licensed practical nurses, LPNs, have a defined scope of practice. They can administer medications, perform wound care, and monitor stable patients. However, they cannot perform initial assessments or handle unstable patients. On the NCLEX, delegate tasks like routine medication administration or dressing changes to LPNs, but keep critical thinking and complex care with the RN. Understanding these boundaries helps you answer delegation questions correctly. Unlicensed assistive personnel UAPs play a vital role in patient care. They can assist with activities of daily living such as bathing, feeding, and ambulation. However, they cannot perform assessments, administer medications, or provide patient education. On the NCLEX, delegate basic care tasks to UAPs, but reserve anything requiring clinical judgment for licensed staff. This distinction is crucial for safe delegation. 5 rights of delegation are your guide to safe and effective task assignment. They include the right task, right circumstance, right person, right direction communication, and right supervision evaluation. Always ensure you're assigning tasks that match the staff's skills and the patient's needs. This framework helps prevent errors and ensures quality care, both on the NCLEX and in real practice. Effective staff management is critical for patient safety and team efficiency. On the NCLEX, you may be asked about handling conflicts, assigning workloads, or responding to staff shortages. The key is to prioritize patient safety, communicate clearly, and support your team. For example, if a staff member is overwhelmed, redistribute tasks or offer support. These scenarios test your leadership and problem-solving skills. Conflict is inevitable in healthcare settings. On the NCLEX, you might face questions about resolving disputes between staff members. The best approach is to address issues directly, listen to all sides, and seek a collaborative solution. Avoid taking sides or ignoring the problem. Effective conflict resolution maintains a positive work environment and ensures patient care isn't compromised. Time management is a vital skill for nurses and a frequent topic on the NCLEX. You'll need to prioritize tasks, delegate appropriately, and avoid distractions. For example, complete urgent tasks first, cluster care when possible, and use checklists to stay organized. Good time management not only improves patient outcomes but also reduces stress for you and your team. Burnout is a real concern in nursing. On the NCLEX, you may encounter scenarios where staff are overwhelmed or showing signs of stress. Recognize symptoms like fatigue, irritability, and decreased performance. The best response is to offer support, encourage breaks, and redistribute workload if needed. Addressing burnout protects both staff well-being and patient safety. Clear communication is essential for safe patient care and effective teamwork. On the NCLEX, you'll see questions about giving clear instructions, using closed-loop communication, and confirming understanding. Always repeat back important information and clarify any doubts. This reduces errors and ensures everyone is on the same page, especially during handoffs or emergencies. SBAR technique, situation background assessment recommendation, is a structured way to communicate critical information. On the NCLEX, use SBAR to organize your thoughts and relay information clearly to other healthcare providers. This method is especially useful during handoffs or when escalating concerns. Practicing SBAR ensures nothing important is missed and improves patient safety. Delegation can be tricky, and the NCLEX will test your ability to avoid common pitfalls. Never delegate tasks that require clinical judgment, and always ensure the person you delegate to is competent. If a UAP is unfamiliar with a task, provide supervision or assign it to someone else. Safe delegation protects patients and supports your team's success. Assigning staff appropriately is a key management skill. On the NCLEX, match patient needs with staff skills. For example, assign complex or unstable patients to experienced RNs, while stable patients can be cared for by LPNs or UAPs. This ensures safe, effective care and maximizes your team's strengths. Always consider scope of practice and patient acuity when making assignment. Sometimes, staff are floated to different units. On the NCLEX, assign floated staff to patients whose needs match their experience. For example, a pediatric nurse floated to an adult unit should care for stable, routine patients rather than those with complex needs. This ensures patient safety and supports staff confidence in unfamiliar settings. Understanding the chain of command is vital for safe practice. On the NCLEX, if you encounter an issue you can't resolve, escalate it to the next level, such as a charge nurse or supervisor. Don't try to handle everything alone. Following the chain of command ensures problems are addressed appropriately and supports a safe work environment. Nurses are patient advocates. On the NCLEX, always act in the patient's best interest, even if it means questioning a provider's order or reporting unsafe practices. Advocacy includes ensuring informed consent, respecting patient wishes, and speaking up for vulnerable patients. These scenarios test your ethical decision-making and commitment to patient safety. Legal and ethical questions are common on the NCLEX. Know the difference between negligence, malpractice, and informed consent. Always document care accurately and respect patient confidentiality. If you're unsure about a situation, err on the side of patient safety and ethical practice. These principles protect both you and your patients. Infection control is a high-yield topic. On the NCLEX, prioritize patients with contagious diseases for private rooms and use appropriate personal protective equipment, PPE. Always wash your hands before and after patient contact. If a question involves infection risk, choose the answer that best prevents transmission and protects vulnerable patients. Patient safety is the foundation of nursing practice. On the NCLEX, always choose answers that prevent harm, such as using side rails, checking patient IDs, and reporting hazards. Safety questions often have more than one correct answer, but pick the one that most directly prevents injury or error. This mindset will serve you well both on the exam and in your career. Certain topics appear frequently on the NCLEX. These include infection control, medication administration, patient safety, and delegation. Focus your study on these areas and practice as many questions as possible. The more familiar you are with these high-yield topics, the more confident you'll feel on test day. Medication administration is a critical skill. On the NCLEX, always follow the rights of medication administration: right patient, right drug, right dose, right route, right time, and right documentation. Double-check allergies and monitor for side effects. Safe medication practices are essential for patient safety and are heavily tested on the exam. Patient education is a key responsibility of the RN. On the NCLEX, questions may ask about teaching patients or families about medications, procedures, or lifestyle changes. Always use clear, simple language and confirm understanding. Effective education empowers patients and improves outcomes, making it a high-priority nursing intervention. Critical thinking is at the heart of the NCLEX. You'll need to analyze information, prioritize actions, and anticipate complications. Practice reading questions carefully, identifying key details, and ruling out incorrect answers. The more you practice, the better you'll become at applying critical thinking under pressure. Effective test-taking strategies can boost your NCLEX performance. Read each question carefully, eliminate obviously wrong answers, and look for clues in the wording. If you're unsure, use logic and nursing principles to make your best guess. Practice with NCLEX-style questions to build confidence and speed. Sometimes you'll need to make an educated guess. On the NCLEX, never leave a question blank. If you're stuck, eliminate answers that are unsafe or outside the nurse's scope. Choose the option that is most patient-centered and safe. Remember, your first instinct is often correct, so trust your preparation and move on. Select all that apply questions can be challenging. Read each option as a true-false statement and only select those that are completely correct. Don't overthink. If you're unsure, focus on safety and nursing principles. Practice these question types to build confidence and improve accuracy. Let's practice a prioritization question. Imagine you have 4 patients, one with chest pain, one with a fever, one requesting pain medication, and one with a dressing change due. Who do you see first? The answer is the patient with chest pain, as this could indicate a life-threatening condition. Practicing these scenarios helps reinforce your prioritization skills. Here's a delegation scenario. You have an RN, an LPN, and a UAP on your team. Assign the RN to assess a new admission, the LPN to administer routine medications, and the UAP to assist with bathing. This matches each role's scope of practice and ensures safe, efficient care. Practicing these assignments prepares you for similar NCLEX questions. Imagine your unit is short-staffed. On the NCLEX, the best response is to prioritize patient safety, redistribute tasks, and communicate with your team. Avoid taking on too much yourself or ignoring the issue. Effective staff management ensures all patients receive safe, timely care, even in challenging situations. Emergencies require quick thinking and decisive action. On the NCLEX, always address life-threatening issues first, such as airway obstruction or cardiac arrest. Call for help, initiate emergency protocols, and delegate tasks as needed. Practicing emergency scenarios prepares you to respond effectively under pressure. Safe patient handoffs are crucial for continuity of care. On the NCLEX, use structured communication tools like SBAR and confirm that the receiving nurse understands the patient's status and needs. Never rush a handoff or leave out important details. Effective handoffs prevent errors and ensure patient safety. Accurate documentation is a legal and ethical requirement. On the NCLEX, always document care promptly, objectively, and thoroughly. Never document care you didn't provide or use vague terms. Good documentation protects you legally and ensures clear communication among the healthcare team. Respecting patient rights is fundamental. On the NCLEX, always support autonomy, privacy, and informed consent. If a patient refuses treatment, respect their decision and document it. Protecting patient rights builds trust and upholds ethical standards in nursing practice. Cultural competence is increasingly important in nursing. On the NCLEX, provide care that respects each patient's cultural beliefs and practices. Avoid making assumptions and ask about preferences when needed. Culturally competent care improves patient satisfaction and outcomes. Patient-centered care means involving patients in decisions about their care. On the NCLEX, choose answers that support patient preferences, encourage questions, and respect individual needs. This approach leads to better outcomes and greater patient satisfaction. Ethical dilemmas can be challenging. On the NCLEX, use ethical frameworks to guide your decisions such as beneficence, non-maleficence, autonomy, and justice. When in doubt, prioritize patient safety and rights. These scenarios test your ability to navigate complex situations with professionalism and compassion. Let's review the key concepts. Prioritization using ABCs and Maslow, safe delegation, effective staff management, and strong communication. Remember the 5 rights of delegation, SBAR technique, and always put patient safety first. Practicing these skills will help you excel on the NCLEX and in your nursing career. As you prepare for the NCLEX, focus on high-yield topics, practice prioritization and delegation, and use effective test-taking strategies. Stay calm, trust your training, and remember that every question is an opportunity to show your nursing knowledge. You've got this. Believe in yourself and your preparation. Congratulations on making it through this NCLEX success guide. Remember, preparation and confidence are your best tools. Review these concepts regularly, practice with sample questions, and take care of yourself during your study journey. Wishing you the best of luck on your NCLEX exam and your future nursing career.